I'm David Cluck. I'm an associate professor at the College of Pharmacy. From an educational perspective, I went to Auburn University, Harrison School of Pharmacy, and then went on to do a PGY1 at LSU Shreveport and a PGY2 at Wake Forest Baptist in infectious disease, where I spent a lot of time in the HIV clinic, at least a couple months, because that is a big interest area of mine. And so from there, my interest in HIV hasn't waned by any means. A typical day for me in the HIV clinic, which is not, I would say is not my full-time practice. It is certainly something that I do on the side, if you want to call it that. So typical day is I go to the clinic usually a little bit before 8 a.m. They have a list of patients that they're seeing, and my role in the clinic is really more of a consultant. I don't really deal with the ordering of medications, the dispensing of medications, anything like that. If there's a complex case, then that's where really I play a role. If we're looking to transition patients to different therapies, or resistance is present, then typically I might have some input, but it depends. I mean, it certainly depends on how complicated the patient is. So my typical day is get to the clinic a little bit before 8. I review the patient charts. If a patient comes in and they're on the only therapy that they're on from a medication perspective is antiretroviral therapy, and they're stable, so they're virologically suppressed, their CD4 count is good, there's not really anything for me to intervene on. So it really, I guess the day-to-day sort of fluctuates based on which patients are coming in, who's coming in. There's also a concurrent ID clinic that's ongoing, and so while some providers are seeing HIV patients specifically, other providers are seeing a mix of ID patients and HIV patients, and so sometimes I'll answer questions that are ID related. The long answer is yes, for a number of reasons, and I would say some percentage of that is side effects, some percentage of that is just indifference. Like, I just don't care to be compliant. I know it's sad to say. There's some percentage that is non-compliant for just various reasons. They can never seem to be compliant, so that's something that's assessed with each clinic visit. How many doses have you missed in the past 30 days? And I think patients need to understand that when they're being asked that question, answer honestly. Don't tell me what I want to hear. If you're answering the way I want to hear, then you're doing yourself a disservice, because when we draw labs and you have a viral load and your CD4 count's not improving, we're going to know you haven't been taking your medications. So there's a gamut of reasons. It's side effects, it's I just forgot, it's I'm not interested in taking these medicines anymore. But notice the one thing I didn't say was cost. So money's never an issue. Patients in the U.S. have there's drug assistance programs throughout the U.S. Money's never, or cost is never an issue for access. But as it pertains to stigma, the clinic should be a judgment-free place. There should be no judgment. There's a lot of other things to say along with that, but anyways, I think that's kind of how I think about stigma. Again, you guys know this, people are extremely judgmental. There's very much a, wow, wouldn't want to be that person type of mentality that's very pervasive. But I think people in this area associate stigma with being uncomfortable. Like, it's a patient population that makes you uncomfortable. I see that a lot. People I don't want to deal with those people, and that's how I know that stigma still exists, is those people. Wait a minute, what makes those people different than these people? So HIV HIV today, I guess there's still a fair amount of people who, and we hear about it in this area, where somebody has HIV and they go to a dentist and the dentist will not take care of them. Come on.
Yeah.
That's just silly. So I think HIV in and of itself, stigma still exists, as we talked about, but those patients, I mean, they're not, you don't treat them any differently medically. Like, there's not a hospital that just does surgeries on patients who have HIV versus, you know, those who don't. That kind of stuff just doesn't happen. Now, I think if there's certain people in the world that they would want that to happen, that they would want there to be some separation, but you know, I guess for me it just comes down to not being judgmental, just being nice to people. I know that sounds really simplistic, but just being nice to people, being understanding, being compassionate. And so much of that is in healthcare professionals is dead. They just don't have it. That's a bone that, or an emotion that's not expressed commonly. So, yeah, that's my take on, or advice, if you will, on caring for HIV patients.